Right now, with like Doctors Against Genocide, we're focusing on being sick from genocide because we are literally, as a community, have become sick from genocide. Other than the intentional targeting of healthcare infrastructures and communities and disabling of people, it's the intentional destruction of anything possible to support it. Growing up in Palestine, unfortunately, I wasn't exposed to disability justice work. If anything, I'm very new to it, so I appreciate you guys having me on this panel. I was wondering, where is my part in this? And thinking back to it, I didn't realize what things we didn't have accessible to us growing up in Palestine. And it wasn't until I came to the US and realized, oh, whoa, there's a lot missing. And then I became part of this society and I'm like, oh, whoa, there's still a lot missing. But what was it different back home? It was the collective approach. So if somebody back home had an access need, yeah, we may not have had a ramp set up or maybe a large enough space, but you bet if somebody was at a bus stop and could not get onto a bus, there's no such thing as time. It's fine. The bus is gonna be late. That might not fly in the US or maybe a place like Japan, right? But men and women will stop there, carry the individual, carry their supplies, and put them on that bus. You bet that bus is not gonna leave without them. So we will find a way, and the way we find that is through community. And the thing is about colonialism and fascism and imperial world is to individualize you, actually almost to a sickeningly pathological level, because then you focus on the you and not the us. The complete antithesis and the complete opposite of colonial ideas is community. So community getting together. The word mutual aid did not exist in my vocabulary until I came to America, because growing up in Palestine, I could knock on my neighbor's door and get sugar when I ran out of sugar. If it was the season of figs, I'd pick up the figs and I'd go to my neighbor with the baskets as a child. And if that elderly person was trying to do dishes and stuff, guess what? I was sitting there doing dishes with them. And I got a second breakfast that morning. Like, why would I complain? Did they get all the gossip of my household from me that morning? Yeah. But that elderly person did not have to reach out for somebody. It was naturally set up in the culture and in the community.
Oppression is disabling. And one of the ways that it is disabling is through dehumanization, and that relates both to the ways that disabled people are often dehumanized, but also the ways in which dehumanizing people sets up the ability to perpetuate these forms of violence and oppression on them. And there's a lot of ways in which, as I mentioned before, with these systems that are made invisible, that we're taught not to be aware of, that we are subjected to manufactured consent to believe that some people do not deserve rights, safety, and life chances, that some people's lives don't matter. And that happens through language. Dehumanizing language is a big part of that. That is very, very, very clear in the way that the Israeli government and military talk about Palestinians, including Palestinian children. And that has been then repeated by a lot of politicians in the United States and also by a lot of supposedly mainstream media outlets in the United States, and that dehumanizing language sort of makes it more acceptable, supposedly, to treat people who have been dehumanized in that way in really, really horrific ways and treat lives as disposable. And we also see that within the United States in the way that dehumanizing language is used towards people of color, disabled people, trans people, and many other populations. And in addition to the language that's being used, as Erin was talking about, allowing conditions to exist where people's needs are not met and allowing that to go unchallenged. And when people become accustomed to that, that's also a form of dehumanization, because if we care about each other and if we see each other as equals, that's unacceptable. And so I think part of challenging this is refusing the language that enables this dehumanization, and then refusing the things that are happening that further it. So refusing the possibility that we can just let people experience this level of neglect and lack of access and lack of care. And in the work that we can do, I think sometimes that looks like pushing for systemic change to resolve those issues, and sometimes when systems are not changing fast enough, or when we don't even know where to start because nobody is listening to us, it means doing other things to fill in those gaps, such as forms of community care and mutual aid, and just even witnessing each other, because another really insidious aspect of dehumanization is not allowing people to tell their own stories, not believing them, and not giving them space to be heard and have those experiences be given the same power that people whose lives are treated as more valuable are given when they tell their stories or talk about what they believe in.
As we've seen right now, Gaza, even before, just in 2017, the statistics was like 21% population dealing with some form of disabilities. So, and then on top of it, we're talking about targeted disabilities. This is like goes back to eugenics, right? Because if you don't aim to a certain part of a body to end one's life, you aim to one that disables them in a way that is intentional, such as the statistics of IOF targeting the groin area of our young men and intentionally. That's why a majority of the injuries that you see are actually lower bottom half of the body rather than upper half. And it's why the children are usually head. So, sorry, that's not. But when you think of this and you think of, that's like on the extreme end of course, disabling a society, you think of all the other forms of disabling a society. So even those in diaspora, you know, or even other communities within the US who have survived a genocide, who have survived ethnic cleansing, who have survived war-torn places, or even just being indigenous in the US and witnessing this happening in other parts. This lives in our nervous system, generational trauma. And trauma, the way it lives in every part of your body. You can't separate it. You can't separate the experience. You can't, no matter how well you are at compartmentalizing, it is affecting you in every part of your life.
Health and healthcare are inherently social justice issues. One of the starkest examples of this that I've been thinking about a lot is something that I heard from the various healthcare workers who I've had the privilege from hearing from, who have worked in Gaza over the last year and a half, including Palestinian healthcare workers based in Gaza and people from all over the world who've traveled there on medical missions. And everybody said that there is no soap in the hospitals. And there are so many types of atrocities that many of us have seen and heard about, but that one sticks with me because it's such a basic thing that has not been permitted to exist in that hospital setting by the logic of this project of genocide that's being enacted in Gaza. And how can you have healthcare if you don't have soap? How can you provide basic healthcare? And how can you provide complicated surgeries attempting to treat wounds that people have acquired from 2,000-pound bombs if you don't have soap? And that's just one of many ways in which not allowing the conditions necessary for health is an issue of social justice, both in terms of every aspect of people's lives and also in healthcare.
And even as us, as healthcare professionals working every day of our lives to treat our patients while we are ourselves holding on to whatever we can to keep ourselves together, expected to separate the two. Be the doctor, be there for your patient, separate your identity, separate how you're feeling, separate the fact that you're witnessing every day people like yourself who took an oath to treat people, no matter what their background is, with tools that you deservingly should be having to treat people with, and just ignore it. Turn a blind eye and do your job. And it's not okay, and it's not right, and we need to speak up. Our patients should speak up. Us healthcare professionals should speak up.
Unicorn Riot, front lines, man, every time.